Good afternoon, everyone. Thank you for joining us today. We're going to go ahead and get started. My name is Nora Landis-Shack, and I'm the Manager of External Relations here at the Fund for Public Health. I'm excited to welcome you all again to our next public health talk in our coronavirus series. Today, we're going to be responding to some of the questions provided last week and explain how the health department is responding to issues of equity in the face of COVID-19. Due to the rapidly changing nature of the coronavirus and the health department's response, we can only respond to a few questions during this talk. You can write your questions into the webinar by using the chat feature. We'll also do our best to send out a survey after this to receive additional questions and any feedback you might have. The talk will last a little over 20 minutes. It will also be recorded. A copy will be sent to you afterwards. And if you experience any technical difficulties during this call, please let us know by emailing info@fphnyc.org. I'm now going to pass it over to Sarah Gardner, our Executive Director.
Thank you, Nora. Hi, everyone. Welcome to Public Health Talks with the Fund for Public Health in New York City. I'm the Executive Director of the Fund. I've been the Executive Director for the last 12 years. For our new listeners, just a bit about the Fund. We're an independent nonprofit that works in close partnership with the New York City Health Department to improve the health and wellness of New Yorkers. We do this by creating partnerships and securing funding to test out new ideas and launch and expedite innovative public health initiatives to keep New Yorkers healthy. During the COVID-19 emergency, we've been working closely with our partners at the health department to secure resources to help them in their COVID-19 response, and in particular to find resources to help the most vulnerable New Yorkers. As the nonprofit partner to the City Health Department, it's also our responsibility to provide important and accurate information about public health. We actually designed these talks for that very purpose so that you can learn more about what the health department's doing, often behind the scenes without much fanfare on behalf of millions of New Yorkers. So today we're going to be speaking with Prachi Patel, who has joined us for the last few public health talks on coronavirus. Prachi works in the Office of Emergency Preparedness and Response. She's joined by Ali Noodleman, who also has been on the last two public health talks. Ali works in the department's Bureau of Intergovernmental Affairs. And alongside many other experts, both Prachi and Ali have been working long and hard to help the city prepare and respond to public health emergencies, and most recently on the COVID-19 emergency. We'll be asking Prachi and Ali a few questions about the health department's response to COVID-19. First, Prachi and Ali, very grateful to have you here today. We know you're very busy, so we appreciate your the time you're spending with us. So let's get to our first question, and the first question is for you, Prachi. So we can only imagine how your work life and personal life has been turned upside down with the onset of the COVID-19 emergency. Can you tell us a little bit about what it's really like for you on a day-to-day basis behind the scenes at work? Any stories in particular that you could share with us to give us a little color to what's going on at the health department?
Yeah, sure, Sarah. And, thank you to you and Nora again for having us. Thanks to everyone who's attending to hear more about what the health department's doing. Like everybody else here in New York City, things have really just completely flipped, working from home, adjusting to that and everything, dealing with the anxiety and the fear and the uncertainty. I think I personally have been home for about 5 weeks now, working from home and just adjusting to that. But then on top of that, continuing my response work has been very challenging. I'm at work but I'm at home. But a lot of my colleagues who work in my office and others throughout the health department have actually been deployed to different places all throughout the city to be doing really important critical functions and field work. And so, everyone's really continuing to work tirelessly on the response efforts all over the city. I'll talk about a few specific things that I know. So I'm sure everyone's seen in the news over the last several weeks, there's been an effort to set up what's called alternate care sites. You might be familiar with, for example, the Javits Center And our staff have been working very close, like side by side with federal, state, and city partners to get all those facilities set up. It's very challenging if you think about it. Those places are used for, large conferences or sporting events, concerts, that kind of thing. But so to really flip it and turn it into a place that, resembles a healthcare setting is very challenging. And our staff have been working tirelessly to work with all those partners to make sure we have enough supplies and equipment, want to make sure everything's set up correctly, want to make sure social distancing is possible, that, everything, the way that it's structured and built allows us to have good infection control practices. We need to train the staff, we need to get the staff, a lot of guidance and technical assistance. Another major thing is really data gathering and management analysis is, it's an ad hoc operation, so there's no systems in place. When you go to a healthcare facility, they may have some sort of system for electronic medical records. This is at Javits Center. That doesn't exist. We really have to, we have staff helping them build systems that actually collect all this information so that we can, track the people and their medical issues, and then also so we have that data to inform what's going on in the city and how we need to respond. As you know, all the New York City schools are closed. There's over 1,200 people working at the health department assigned to the Office of School Health. So that could be administrative staff, they could be school health nurses or school health physicians. And because they're not in schools, it's a critical and really valuable resource the health department can use for other purposes. And, for those that do have some sort of medical professional or license, they could be, key to providing surge for healthcare facilities. So these staff are being redeployed all over the city to help at healthcare facilities, particularly for our public healthcare system, H&H. And so they're really assisting in something that we've all seen in the news is really needed in the surge staffing area. The third thing I wanted to highlight is I have some friends working there. You may have also seen in the news that New York City Department of Health has a warehouse where we have a stockpile inventory of all kinds of medical supplies, and we are working to get those critical supplies out to the healthcare system, whether it's hospitals or nursing homes, adult care facilities. So we're actually receiving equipment and supplies either from the federal government or even large donations. So we take those items, or we take what we already have in inventory, and we're distributing them all over the city. And it's just a huge undertaking. My colleagues are actually staying in New Jersey. They haven't been home in weeks. It's a 24/7 operation. You think about just trucks and trucks and trucks going out every single day, hundreds of pallets, like tens of shipments a day. It's just a massive operation, and our staff are out there at the warehouse working with our contractors to make sure the healthcare system is adequately supplied and equipped for this response. Those are a few examples.
Thanks, Prachi. That was really informative and gave us a good sense of what your day-to-day has been like. One of the other big things that we're hearing about in the news is the whole issue of testing and how to get a COVID-19 test and the availability, lack of availability. Can you explain how the health department has been involved in testing? And in particular, can you talk a little bit about what's happening at our public health lab?
Yeah, so what happens whenever there's a new disease, so if folks remember in 2014 when we were dealing with Ebola and just getting ready for, the potential of having a case here, like test capacity does not exist if it's a new disease. So there's very specific equipment that's needed. It could be equipment you already have that's used for other diseases, but there's specialized kits and things, like there's chemical reactions that have to happen for the testing and the reagents and all that kind of stuff. So, we're really reliant on the federal government to develop those things and get it to us. So at the very beginning, whenever there's a new disease, the state and local public health labs are the only entities that are really able to test. So we are still conducting testing. and we began testing in early March as soon as the test kits were approved and provided. You may have heard in the news that New York State actually had a test online just before CDC was able to get us. So the lab is also always constantly changing and what's called validating, and it's the way that you are making sure your equipment and things are sensitive to the thing you're trying to test. And so we started off with the New York State test, and then the CDC, and now they're coming out with another test. So it's always, trying to get at the most up-to-date and latest testing strategies to make sure we're keeping up with the science and technology and able to do higher volume and faster testing. So we started in early March, and the PHL has performed thousands of tests. The testing volume is a little lower now because hospitals and commercial labs are now able to test. But at the peak, PHL was performing, like 300 tests a day or something. So now that testing is available through hospitals and other commercial labs, as the public health department, PHL, our lab's role really is to fill in the gaps. And so we're looking more at how we can make testing more accessible for vulnerable populations and prioritizing those healthcare facilities that can test on their own. PHL staffing is about 200 staff, and they are all engaged in the response right now. So our testing continues at 24/7 capacity. And you may have also heard in the news that, as we go through different phases of this pandemic, the next phase really is suppression. You might have seen what, there were some actions may have been taken over in other countries in Asia where this started. And so we're starting to plan for a massive contact tracing initiative, and that includes really expanding testing for COVID, expanding the sites we have to test, expanding the staffing. And then you may have also heard the governor announce that we're all going to be doing serologic testing, which is for the antibodies. So that's really getting at the immunity factor about all of this. So testing still is a huge operation for us. It's still ongoing. Like I said, they need to make sure they have the state-of-the-art testing equipment and all the supplies. And these things cost millions of dollars to purchase and maintain. There's a lot of, obviously, safety considerations. They have to social distance just as much as anybody, and they're a high risk for getting exposed because they're actually dealing with the specimens. It's a very high stress job. And also, as the public health lab, they provide guidance and technical assistance to healthcare facility labs to make sure that they are using the right protocols to safely and properly handle the specimens and that they're doing the testing properly, because we want to make sure that the results we get are most accurate. And also, when we have supplies or kits and things that healthcare facilities may be experiencing shortages, or we've gotten donations and that sort of thing, we're also providing critical supplies so that other facilities can actually also be testing.
Great, thanks, Prachi. Yeah, I think it's not very frequently that people in New York hear about the public health lab, so that was very informative, and it's such an impressive role and effort that the health department is doing. This is the last question for you, then I have one for Ali, and I think you touched on this in your first one, but there's been a lot of questions and concern about PPE, or personal protective equipment, and why there's been such a shortage, and how this has been such a priority of the city to source and distribute PPE, in particular to the hospitals. We've seen healthcare personnel, complaining about the lack of access to this equipment. So what specifically has been the health department's role in distributing PPE?
Yeah, so at our last public health talk, I touched a little bit about, we plan for these kinds of things day to day. There's a dedicated office, there's dedicated funding and staff. We do exercises, we do drills, we buy supplies and equipment, and we maintain all this stuff. So day to day, I talked about the warehouse a little bit. So we do have an inventory, and really the health department's job is to retain some inventory, specifically either for first responders or for healthcare facilities. So we don't stockpile and we don't maintain inventory for the public per se. Clearly, this pandemic is something, the size and the scope of which we just really hope we would never need to deal with. And, maybe have been planning for a really long time, but until you're really doing it, it's really hard to imagine what it might all entail. But we do have inventory of the personal protective equipment that includes all kinds of health and safety, masks, gloves, gowns, eye protection, and even equipment like ventilators for actual patients. These things are, like gloves, they're really they might be easy to buy, they might be easy to store, but ventilators it's complicated equipment. They're expensive to buy, they're expensive to maintain. They're very specialized. You need to be trained about how to use them. You might have heard a lot about N95 respirators. Those actually need to be fit tested, which means you need to have it fit to your face and have it be tested that you can't, smell or taste anything. That's how you know the barrier is actually there. So just having the masks themselves is not, obviously in this situation, any mask is better, but we do have this inventory and we play a critical role in obtaining it and distributing all of this to healthcare facilities across New York City. And we have been receiving equipment and supplies from the federal government. That's part of the plan. There's something called a Strategic National Stockpile. It's a federal inventory for instances like this. And then we maintain a little bit of our own inventory. And then we've been having a lot of donations, either large corporations or the manufacturers of some of these things have been providing us as well. And so we're going out and actually delivering them to healthcare facilities. So we have a contractor that maintains capacity for the storage, for the transportation, all the labor, all the packaging, everything related to that. And since mid-March, we've distributed approximately 5 million N95 respirators, 25 million face masks, and about 3,000 ventilators throughout the city. So it could be hospitals, nursing homes, adult care facilities. And it's not just one delivery. If there's sort of requests ongoing for replenishment and additional, it's like we may keep going back to the facilities, every few weeks and stuff. So, in a month we've done all this, and so we'll continue to do so moving forward.
Great, thanks, Prachi. Now, Ali, let's turn to you. So we've heard a lot in the news also about how COVID-19 is disproportionately impacting communities of color and the need for interventions to support these vulnerable groups. Can you talk a little bit about what the health department is doing to address this?
Sure. Thank you for that question. This is critical to the health department's work, even pre-COVID, and our mission to address systemic health inequities. As the data have shown, while every community and zip code has been affected by COVID-19, there are stark disparities in who's been hit the hardest. And that includes Black and Latino communities, low-income communities, and immigrant communities in the city who have had less access to healthcare in their lifetimes due to systemic health inequities in our healthcare system. And this is not something that we can accept. So in the next phase of testing, we're going to be expanding to the community level and target the unmet need in these communities. And so we've started that already by creating community testing sites, working with H&H at existing clinics. So that's in East New York, in Morrisania, in Harlem, in Jamaica, and on Staten Island. And we're also partnering to increase testing capacity for healthcare workers, working with 1199. And the city is also opening up, the mayor announced this morning, the city is opening up 6 new testing sites with priority for NYC residents and other nearby residents with risk factors. And that includes neighborhoods like Williamsburg, Woodside, and other parts of the Bronx. And so there's going to be a priority system focused on those who are most vulnerable, which includes older folks and those with pre-existing conditions that might make them more vulnerable to more severe instances of COVID-19. And, this is all reliant, as Prachi was saying, it's sufficient supply of testing kits and PPE required to do this work effectively. But as long as we can get those supplies, this is where we're going to be focused. And we're also working to make sure that what we're doing is one category and making sure that people know what we're doing and making sure that our messaging is reaching everyone, regardless of where they live or what language they speak. And so we've been doing media campaigns, both encouraging people to stay home and explaining when and where to seek medical care. And those have been translated into multiple languages and in print and online media, and also through ethnic and local media outlets.
And so we're trying to reach everyone where they are about sort of where things are right now and what we're doing to make sure that communities that are hit hardest are targeted to make sure that it doesn't get any worse.
Thank you, Allie. Thanks to both of you. We're coming to the end. We're running out of time, and I really want to thank Prachi and Allie for joining us again. We really appreciate all the work you and your teams are doing at the health department to keep us safe. Thanks to our listeners for joining. We hope to do these presentations as often as we can during the COVID-19 emergency, and are grateful to the health department for taking the time to join us. As soon as this is over, shortly, you'll be receiving an email with a link to the recording and a survey where you can share any additional questions you might have that we could perhaps address in future public health talks. We really appreciate your feedback and use your feedback to improve the talks for next time. So please share your thoughts. And finally, I just wanted to remind everybody that the fund is raising money through its epidemics fund to support urgent projects related to COVID-19, and assure you we work directly with the health department to identify the areas of greatest need where a gift can have the most impact. If you want to give to support our epidemics fund, please visit our website. The link is visible on the screen. Please be sure to follow us on Twitter, Facebook, and LinkedIn to stay updated and learn about upcoming talks. Thank you again for joining, and until next time, stay healthy. Thank you.